The culture that we've tried to grow at Bakersfield Memorial Hospital ends up basically focused on 3 words: supportive. All the caregivers that participate in delivering patient care here support each other in the outcomes for the patients. The second characteristic is adaptive. We know that we're going to have to occasionally adapt to take care of that patient's needs along with the patient's family. So we're always making sure that we understand that. And then the third is delivering human kindness. It's not just the patient care that's provided, it's the other supportive activities that go around in taking care of the family, in meeting the community needs. And we know that we're always going to focus on delivering human kindness, and that's what sets us apart.
Our program mission is well aligned with our sponsoring institution, Morehouse School of Medicine mission, through its focus on health promotion and healthcare delivery in underserved communities, with our own community, Kern County, being one of the most diverse underserved community in the nation. To attain this mission, the program developed few strategic aims to ensure that our residents will master the 6 ACGME clinical competencies in order to become very successful, resilient, and competent physician, to provide training inpatient and outpatient with possibility of a tailored schedule for each resident, with compassion to advance the understanding of research, quality improvement, and patient safety initiative. We offer a unique training experience, as our residents will mostly train at Bakersfield Memorial Hospital, ambulatory care, general internal medicine rotation at Clinica Sierra Vista, the 6th largest federal qualified health center in California. At both sites, the residents will have the opportunity to work with very experienced, dedicated, and compassionate physicians.
The strengths of the Transitional Year program are really rooted in the focus that we have on teaching, the focus that we have on having you get an experience that you are going to learn medicine from people that care, from people that have stake in, the community, and also an opportunity to get to take care of a wide range of socioeconomic, background patients, wide range of different languages, at a hospital that has a lot of different services. And the beautiful thing about being a resident is that you want to learn something more than just the part that I can teach you as an ER doctor. Wonderful. The patient's being admitted to medicine, go ahead and go ask the medicine doctor what you can learn from them. The patient's going to go up to the OR, ask the general surgeon what you can learn from them. Maybe you can pop up into, the OR and ask the anesthesiologist, what are they going to do? Why are they considering one medication versus another medication for the sedation of this patient? So this is the opportunities that the hospital provides. You have wide range of specialties and also services that are provided, with a lot of people that really want to make you succeed, give you an opportunity to learn.
Being the funding program director for a Transitional Year Residency Program brings me a lot of joy, as I will work alongside with a group of very experienced, dedicated, committed physicians to train the next generation of physicians and also the next generation of leaders in medicine, knowing that some of them will return back to our community to practice medicine as specialists and to serve our community.
We're the largest community hospital in the area. We have 385 general beds, medical ICU, neuro ICU, neonatal and pediatric ICU that they can also train here, as well as a burn unit.
Clinical experiences offered to our residents in the emergency department is both on the pediatric side and the adult side. The residents will have an opportunity to take care in the critical first hours that patients arrive to emergency departments. So that includes everybody from being, 1 or 2 days old all the way to, over 100-year-old, patients. And it includes everything from, cardiac emergencies to strokes to orthopedic injuries to, less severe illnesses. But it's a wide range of both ages and wide range of, pathophysiology that the residents will get a chance to see. Especially in the emergency department at Bakersfield Memorial, we have such high volumes and also such a wide range of patients and pathophysiology that it'll give the transitional year residents a wonderful opportunity on honing their skills on taking histories, doing physicals, learning what studies to order for the initial workup of patients, and then of course procedures. I mean, we got so many patients that are in need of different procedures being done, and it's your wonderful opportunity to get to learn from these patients from lumbar punctures, intubations, paracentesis, thoracentesis, you name it. You like laceration repairs? You like fracture reduction? Come on down. So I did a 2 through 4 emergency medicine residency here in Bakersfield. My first year was a transitional year outside of Bakersfield, and I think that's really the portion that has gotten me so excited to be able to contribute towards a transitional year residency. I myself went through that program, and so for me it was an incredible opportunity to go from one specialty to another and really trying to work on having the mindset that, okay, this month I'm an OB doctor, next month I'm going to be a colorectal surgeon, next month I'm going to be a urologist, and having that opportunity to go from one specialty to another was phenomenal. And then the 2 through 4 year residency here in Bakersfield obviously was focused on emergency medicine. That's my specialty. But it also gave me an opportunity to get to interact with the attendings in all the different specialties, everybody that we're consulting from the ER, everybody that we're admitting patients to. So overall, a great experience, and I'm hoping to be able to turn around and let the next generation of physicians get that same great experience and training.
What I find unique about this facility from an anesthesiologist practice perspective is our wide capture area, geographical area in Kern County, which allows a very diverse representations of disease in various stages. We have several surgical subspecialties that are quite active and cover almost every aspect of anesthesia practice in today's world within the walls of our hospital. So we feel that it will provide our residents with very in-depth look at anesthesia practice and prepare them for dealing with anesthesia or practicing anesthesia in their future. One aspect that is quite unique about our facility is that we have been recognized by US News and World Report as a high-performing hospital center. We are also a STEMI and open heart capable center, and we are a thrombectomy stroke center that serves this region. So this greatly enriches the experience of our residents to be practicing in such a unique facility. When it comes to why we faculty members have chosen to be involved in academics, the answer to that really has to what we are passionate about in the practice of healthcare. We strive to impact our patients' lives positively, and by teaching our skill to the next generation of physicians that will similarly impact patients' lives positively, we basically multiply that effect. So it goes down to our passion of service and patient care, and education is a big part of it.
For nearly 70 years, Bakersfield Memorial has been serving this community. This ends up being a family. This family caring for patients goes above and beyond just the patient care that happens within the four walls of the hospital, whether it's through community outreach, whether it's volunteering through a number of different organizations, whether it's giving back in one way or another, we're all doing that. This really is a special place. Using my personal example, I was here for 5 years between 2003 and 2008, but felt the urge to come back when I had an opportunity, and have been back here since 2015. And it's because of the people, it's because of the place, it's because of the culture, and it's because of the heart that we have in each other and caring for the community.